Now, Boston Mayor Marty Walsh is telling university students and college students there that if they go home for the holiday, they should be prepared not to come back before the end of the semester. And Boston Mayor Marty Walsh joins us live now for more on this. Mayor Walsh, welcome back to the program. You know, Boston is a city full of colleges and universities, including my alma mater, Boston College. It's also a city full of restaurants and bars. We heard one of the mothers in that video talking about that balance between closing schools while keeping bars open. This is a debate that goes on a lot. So how do you make that call as the mayor of a city when deciding whether or not to close schools and whether or not to keep things like bars and restaurants open?
Well, first of all, thank you for having me on today. And I just want to let you know I'm an Eagle as well. So go Big City.
Go Eagles.
Here in Boston, the bars are not open yet. We just have restaurants open, and they're open at limited capacity. We also, throughout the summer, had 550 restaurants that have outdoor dining, so was able to supplement some of the tables. We're at a very tricky place right now when it comes to the virus. We're seeing an increase here in Boston, a 7-day average of about 225 cases per day. Hospitalization rates are still not where they were in the peak of COVID back in March and April and May here in Boston. So that's a good thing. But what we're asking people, those students that are here in Boston that are on college campuses, if they do go home for the holidays, if they're meaning out of state, we're asking them not to come back if they could just do the rest of the semester online. Many of our colleges are making that a rule here in the city already, so that they've done that. Boston University is one of those schools. What we're trying to do now is really about stopping the spread. I mean, I heard the report right before I got on. Our schools in Boston, for the most part, have not reopened this year. We do have about 180 kids, the highest needs students in our schools. And our goal is to reopen the city. Our goal is to reopen the Commonwealth here if we can as quickly as possible. But these numbers are going in the wrong direction. I wouldn't say it's a surge or a spike yet, but I would say it's certainly concerning to me.
Does being a city that has so many colleges and universities in the area, does that change your approach to the pandemic at all?
I'll tell you, the colleges and universities, most of them here in Boston, have done a great job. That student that spoke a minute ago, they have very aggressive testing protocol in place. They're testing many of their students. They've done a hybrid model, some online classrooms and some in-person classrooms. We have not brought back all of our students yet, so you can imagine the economic hit that the city's taken, the restaurants are taking, and all of the retail shops are taking. But right now, in this pandemic, you also mentioned 250,000 Americans have lost their life due to coronavirus. This virus is taking lives. This virus is serious. And, the CDC is recommending people for this Thanksgiving holiday just to have Thanksgiving with your immediate family, no visiting, no traveling throughout the country. It's something that the more we can get this virus under control right now, and scientists have said that we can, as individuals, get this virus contained. Now's the time to do it so we don't see these spikes and don't see increased loss of life and see further damage to our economy down the road.
And one of the big concerns that we've heard since the beginning is flattening the curve. So how are your hospitals holding up right now?
Hospitals are doing pretty well. I mean, we did flatten the curve here in Boston. Our spike was back in early in the year. And for about a 3.5-month period, we saw an infection rate of about 1.8 to 2.8%. What that was about 20 new cases per day. And now we're averaging 230 cases per day. But we're not seeing, as of right now, that huge increase in emergency room ICU capacity. So we're monitoring ICU capacity. We're monitoring emergency room visits. And we're monitoring capacity, not just by COVID-19, but we're also monitoring capacity by other illnesses that people are going in. So as of right now, today, we're in decent shape here in the city of Boston. But as you know, and everyone knows, the virus changes day to day. So we don't know what tomorrow will bring.
And New York City just closed schools again. That's sparking a huge debate around here, but also nationwide. I know, as you said, Boston has kept many schools closed. What drove that decision? And what do you say to critics who don't agree with it, parents who are struggling, that kind of thing?
I mean, I heard the mayor talk yesterday on TV, and what he's worried about. They have an increased numbers of cases, and I think at the end of the day, a lot of people say most of our cases right now in Boston, they're happening in the work site and they're happening by gatherings. Much of them are happening with people under the age of 29 years old. If a child gets coronavirus, the numbers all say that child will recover and will be okay. But what happens is if you have elderly parents or grandparents in your house or people that have existing conditions that are very the virus is dangerous for, you put a lot of danger into the household. So I do think for all of us, it's about containing the virus. There's many different theories and thoughts about. I heard somebody else say the restaurants are open. Right now in Boston, we're not seeing a spike in the restaurants. Maybe we'll see a spike in a couple of weeks when outdoor dining isn't no longer available here in the city. But at the end of the day, we need to get the virus under control. Millions and millions of Americans have come down with coronavirus. We know that it's caused 250,000 deaths nationwide. And the doctors can't tell us what the side effects or what the long-term effects might be of getting the coronavirus and recovering fully. There's many mixed messages on that. So I think that we're still very early in the virus to be scientists or doctors and make our own self-determination that it's safe to go out there. And I think it's, when the CDC and other experts are saying that the best way to combat the virus is by wearing masks, physical distancing, social distancing, maybe not going to school, maybe not going to work, then we should listen to the scientists and the doctors.
The biggest line I've heard so far is that the schools have not been shown to be likely hotspots. So why close the schools if that's not where kids and other people are being infected?
Because the potential is there. And when you talk about a rate that gets too high, our infection rate in Boston today is about 9%. We have 225 cases per day. Our hospitalization is not being overburdened at this particular moment. If you start to see hospitalization being overburdened, we have to shut down society, because what will happen is we'll put too much strain on our hospital system. So not only with patients with coronavirus, but patients with other illnesses will be put in danger. And it really is about keeping our hospital systems, in some cases, keeping our hospital systems open for people that need them.
And Mayor, quickly, do you feel you're getting the resources you need at the state and federal level right now?
I mean, I think things that concern me right now are the availability of tests and the cost of them. I'm trying to encourage people in Boston to get tested once a week, and the cost is still extremely high. Insurance companies don't cover that. I'd like to see a change there. And also my concern long-term with the vaccine. If insurance companies don't cover the vaccine, many Americans won't have the ability to pay for getting a vaccine, or they'll just choose not to get it. And I think that our medical system have to think about those two issues, because in order to really understand whether it's New York or Boston or anywhere in the country, what we're dealing with is to get an accurate account of what the virus numbers look like in our cities. And if we can have real good, accurate testing and be able to say that what the percentage rate is, that will allow us to make decisions based off of that. And hopefully those decisions will not be to shut society down, will allow us the opportunity to open up again.
All right. Boston Mayor Marty Walsh, we appreciate your time again. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.